Hi, I'm Scotty. I'm a student nurse with the University of Charleston in Beckley, West Virginia. Today I'd like to talk with you about diabetes mellitus. Diabetes mellitus is a metabolic disorder that results from either inadequate production of insulin or the body's inability to respond to insulin that's already present. This occurs when the body cannot properly store and use glucose, which is essential for energy. This sugar or glucose then collects in the blood and does not reach the cells that need it. If you don't have sufficient insulin, the glucose level in your blood will get too high. This may contribute to the development of hypertension, cardiovascular disease, neuropathy, kidney disease, and stroke. Type 1 diabetes is inadequate insulin production, and type 2 diabetes is insulin resistant. Risk factors associated with diabetes mellitus type 1 are genetics or a viral illness. This is an autoimmune disorder where your body does not produce insulin, and you are insulin dependent for life. Type 2 is due to insulin resistance. Risk factors for type 2 are due to poor diet, which is high in sugars, such as sodas, sweets, and white bread, and a sedentary lifestyle. This combination may lead to metabolic syndrome, which is a cluster of conditions that occur together, increasing your risk of heart disease, stroke, and type 2 diabetes. These conditions include increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol or triglyceride levels. This is more common in males and more prevalent in African Americans, Native Americans, and Hispanic populations. Manifestations of diabetes mellitus may present in a number of different ways. Hyperglycemia, or high sugar, may be due to an infection, surgery, medication compliance issues such as taking your insulin, or steroid use like prednisone. Signs of hyperglycemia are polyuria, which is excessive urination, polydipsia is excessive thirst, and polyphagia is excessive hunger. Hypoglycemia is low blood sugar, 70 or less. Signs of hypoglycemia are headache, sweating, clammy skin, pallor, nervousness, irritability, hunger, lack of coordination, as well as feeling sleepy and weak. A clinical manifestation for insulin-resistant type 2 is brownish skin, thickening of the neck and armpit, known as acanthosis nigricans. Diagnostic criteria and tests most often used for diagnosing diabetes, according to the American Diabetes Association, include fasting glucose level higher than 126 on 2 separate tests, a 2-hour plasma glucose level of 200 milligrams per deciliter or higher during a glucose tolerance test, or a HbA1c higher than 6.5. Type 1 diabetes can't be prevented, but healthy lifestyle choices may be helpful in treating prediabetes, type 2 diabetes, and gestational diabetes, such as eating healthy foods. Choose lower foods in fat and calories, higher in fiber, and focus on fruits and vegetables and whole grains. Strive for variety to prevent boredom. Exercise. Aim for 30 minutes of moderate physical activity a day. Weight loss to promote a healthier heart, more energy, and an improved self-esteem. Don't drink alcohol or use illicit drugs. And go to the doctor for checkups at least once a year. Sometimes medication is an option as well. Oral diabetes drugs such as glyburide, glipizide, or metformin may reduce the risk of type 2 diabetes, but healthy lifestyle choices remain essential. Insulin medications that may be used for diabetic management are long-lasting insulins like Detamir or Glargine. NPH is an example of intermediate, or regular insulin is an example of the short-acting insulin. Foot care management is essential with diabetic patients. This begins with checking your feet every day for any sores or injuries. Clean your feet daily with soap and water and allow them to thoroughly dry. Wear soft, cotton, absorbent socks and shoes that fit properly. Immediately visit a doctor if there are any sores or infected areas on your feet. Maintain a low sugar diet and keep blood glucose levels as normal as possible. Prolonged high blood glucose damages nerves and blood vessels in your lower legs and feet. The feet must be kept clean, dry, and free from injury. Diabetic diets are individualized due to physical activity and medication therapy. The American Diabetic Association diet recommends carbs at 45 to 60%. This would be grains, vegetables with starches such as potatoes, corn, sweets, cookies, soda, dried beans, and milk. Fats to be kept less than 20%. Limit unhealthy fats and saturated trans fats and cholesterol, such as lard, gravies, whole milk, bologna, hot dogs, sausage, processed foods, hydrogenated oils, and concentrate on mono and polyunsaturated avocados, olives, and peanuts. Proteins to be kept at 15 to 20%. Meats don't increase the glycemic index, so this would include meats like chicken, turkey, and fish, as well as plant-based beans, peas, and low-fat cheese and egg whites. Complications that are associated with diabetes mellitus are renal failure, neuropathy, retinopathy, hypertension, and atherosclerosis. It is important to be aware of the signs and symptoms of diabetes mellitus. Early intervention may save your life or limb.